Pavel, what is the meaning or practical importance of this decision?
Well, it's in fact, these are major recommendations, I would say, and it's a kind of set of recommendations, and it means really streamlining of control of cannabis and THC. And I find as a major thing the deletion of cannabis and cannabis resin from Schedule 4 of the 1961 Convention, where you have substances which are considered not having medical importance. Now it's moved to Schedule 1 only, and that means that it should be available for medical purposes. And in fact, what I find very important, governments have under the 1961 Convention an obligation to make these drugs available for these purposes. So this changes totally the position of cannabis and cannabis resin under the conventions. And of course, the other recommendations like moving THC from the 71 Convention to the 61 Convention, that's a very correct decision. This makes the system really logical. This should have been done, let us say, in the 1960s and has not been done, but fortunately it is recommended now. So there will be major developments, it may have major impact. There are suggestions, there is a proposal to place some preparations of cannabis and THC in Schedule 3 of the 1961 Convention of exempted preparations. So I think it could be extremely beneficial for patients. Yeah.
Would this affect national laws, say in countries that have the death penalty for drug possession?
Well, this is a good question. Definitely it will affect national laws because governments have obligation to translate the provisions of the treaties in their national legislation. So definitely this will have impact, and all countries will have to modify the position of cannabis, THC in their national legislation. Your question is very interesting with respect to the death penalty. Definitely, in the present system, cannabis is Schedule 4, for example, with heroin, you know. So now it is clearly shown that, let us say, the smuggling or abuse or illicit traffic in heroin, well, there is a difference between heroin and cannabis, and this should be recognized. In fact, with respect to the dangers associated with the abuse, with the illicit traffic of these drugs. As a world top scientist in cannabis, what would you say about the importance of these recommendations?
I think that this represents a momentous moment in the history of drug control, because now it should be possible in each country to develop cannabis as a medicine. So it represents a recognition on the part of the World Health Organization that this can be a therapeutic drug whose use is safe and effective. This is best illustrated by two examples. That of Sativex, cannabis-based medicine, which is approved in 30 countries for the treatment of spasticity and multiple sclerosis, and that of Epidiolex, predominantly cannabidiol preparation that is approved by the U.S. Food and Drug Administration for treatment of severe epilepsy syndromes. These two drugs demonstrate the safety and efficacy of cannabis, and it certainly is the case that additional preparations from cannabis should be forthcoming, and hopefully this will clear the path so that additional research and development can take place. Specifically in the United States, I hope that this decision on the part of the World Health Organization will lead to legislation in the United States that will allow cannabis commerce across state lines and international frontiers. Until the present time, there's been an extreme limitation on clinical research in the United States because of the interpretations that have been in place in relation to the Single Convention Treaty of 1961. Hopefully there'll be a recognition now that additional sources of cannabis can be tested by companies or universities to further assess the therapeutic potential of cannabis. This ruling by the World Health Organization, how will this be applied to individual nations, and what would be their obligations to follow the recommendations?
Yes, in fact, this is a recommendation of the World Health Organization, and it will be submitted to the UN Commission on Narcotic Drugs in March this year, and the Commission will be voting on these decisions. So, with respect to the decisions concerning the 1961 Convention, it needs a simple majority of the members present and voting out of these 53 members of the Commission to approve a recommendation of WHO. This is a necessity. Of course, the Commission, where government representatives are present, should take the recommendation of the WHO as a scientific recommendation based on evidence, and they should not again look into this scientific recommendation like that. However, they may have other considerations, and so we will be waiting for this very important decision of the Commission in March, hopefully in March this year.
Right. Could this be hijacked for political reasons? What is your expectation of what will happen?
Whether it will be hijacked for political reasons, I hope not. I will not speculate how government representatives in March will express their opinions to this recommendation. I think among members of the Commission there is already a number of countries which are using cannabis and cannabis preparations for medical purposes, so I think that the knowledge will be high, and I hope that the recommendations will find a positive response from the Commission.
Would a single nation have any veto power over the decision?
No, there is nothing like that. Of course, the Convention says that countries may adopt control measures which are more severe and strict than those in the Convention. That means if the Convention says cannabis should be available for medical purposes as any other drug in Schedule 1 of the 61 Convention, a government of a state may decide that in that country this will not be the case. Of course, it would be against the recommendation of the Commission, and in fact against the general obligation of the Convention to make these drugs in Schedule 1 available to patients for medical purposes. But we cannot exclude such cases, and it may be a gradual process. It's a good start, I think, and it will be also a very important information for governments and patients, this recommendation and this, I hope, decisions of the CND.